my name is Caroline and I'm a registered veterinary technician here at Selkirk Veterinary Hospital, and I'm going to talk to you a little bit about Pet First Aid as it's Animal Health Week from October 4th to October 10th. Last but not least, we're going to talk about something that may not be very familiar to people or they may not be very comfortable with. So this is just a basic starter on CPR. If you see an animal in distress and you believe that it requires CPR, this is the best way that you should handle that particular situation. First things first, they may need CPR for any number of reasons. They may have choked on something, they may have been hit by a car or had some sort of trauma. But the first thing we want to look for when we're about to perform CPR is, number one, is the animal breathing? If the animal is breathing, they do not require CPR. We can check for breathing by watching their chest rise and fall. Rise and fall. Even if they're taking slow breaths, they do not require CPR. Then we're going to check for a heartbeat. We're going to do that the same way that when we had Lady on our table, we're going to move our animal's elbow and feel right about where the elbow hits the chest. We're going to hold that for a few seconds. If we're not feeling a heartbeat, then we might need some CPR at that point. So we're going to make sure that there's nothing around our animal's head that may cause us any damage. We're going to check the airway of the animal. We are using a stuffed rover for this particular demonstration. So we're going to check our animal's airway, make sure there's nothing blocking the airway. Look down deep in that throat, and if you can, even just give the tongue a bit of a pull and see how far back you can get back there. Then you can offer them artificial respiration. And you do this by pulling the animal's tongue out and out of the way, and then you can place your hands over the nose and directly pull a few breaths into the animal's mouth. 1, 2, and then see if the chest is rising as you do that. And then see if the chest is rising as you do that. Sometimes you can also close the animal's mouth and blow into their nose the same way. When you do this, have somebody else see if the chest is rising. And those are the ways that we can give them artificial respirations. If you have a helper, you can tag team and somebody can be breathing for the animal and somebody can be performing chest compressions. So while my partner is up at the head, I'm going to feel for where the heart may be or should be located just behind the elbow. And on a larger breed dog, it's pretty much like performing CPR on a human. You want to be able to have your hands together and give about 10 to 12 beats and then wait for about 5 seconds, and in that 5 seconds you can give a breath. So we're going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And your partner can give the animal a breath, and then you can repeat the process. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You do have to push fairly hard. Their rib cage is right there, so don't be afraid to give it a little bit of effort. Another thing that you can check for is a pulse in the back end of the animal. Not many people know that they have a little spot on the inside of their back legs where you can actually feel their pulse. So if on Rover were to demonstrate here, the inside of the back leg of the animal, the femoral artery runs underneath here. You can take your fingertips and place it kind of right in the groin area of the animal, right against the leg, and see if you can feel a pulse. It should be beating fairly quickly for small dogs or cats, and then fairly steadily, and maybe about 80 beats per minute for a dog. So these are different ways that we can feel for a heartbeat. We can give our animal artificial respiration, but in one of these situations, it's imperative that you get to the veterinarian right away. With everything, always remember that a basic pet first aid kit is no supplement to proper veterinary care. Please do your best to stabilize however you can and get them to a veterinarian as soon as possible to be able to treat any injury. We definitely appreciate at-home care as best as you can, but nothing can substitute all the pain medication and possible emergency life-saving measures that we can do here at the clinic.